I trained at Stanford in dermatology, and I've been practicing. I have two practices, one in the San Francisco Bay Area and one in Beverly Hills. So for the last 5 or 6 years, 6 years now, I go down to Beverly Hills every couple of weeks, every couple of months actually, do fillers, do Sculptra, do photofacial treatments. So if you have questions about what we're talking about or what I'm talking about, do feel free to email me as well. So I have my email addresses here. Let's see. Is this one? Oh, this must be our AMP answer. Okay. And then I do speak for some other companies. Saiton, Sanofi Aventis with Sculptra, and Edge Systems are 3 companies that I'm currently on their speaker board for. So I'm assuming that all of you here were interested really in aesthetics and aesthetic medicine. And so just to be really on the same page, what our patients are interested in are they want to look better. They want to look better, preferably without downtime. They want to look better right away. They'd like to look better without a procedure being painful or without it hurting. More and more people are really interested in wanting to look better without surgery, especially for the baby boomers. If you're doing aesthetics right now, you hear this all the time, that people really, they're not eager to want to go and have a facelift or a neck lift. They'd like to be able to really look better without undergoing the knife, without having to have the scalpel pulled out. More and more patients are expressing to me they want to look natural. They don't want to have you do something for them, and then they go out and they see their friends, or they go back to work, they see their coworkers, or they see their family members, and have people look at them and say, "Who'd you see?" Because that's not, I think, the hallmark of a good result. Rather, it should really be where they go out and they see their friends, and people say, "You look great. Something looks different. Something looks better about it. Are you doing your hair differently? Are you using a different makeup?" That's what I love to hear from my patients. And that's what I'm really interested in wanting, regardless of what you're doing, whether it's skin rejuvenation or augmenting lips or putting fillers in or doing Botox. I think that's really the holy grail of what we want to achieve with aesthetics, is not a result that looks obvious to the world that you've done something. And I'll talk a little bit more about that later. With the economy in particular as it is, people want procedures that are not outrageously expensive. And so patients have become a bit more price sensitive, even in Beverly Hills. I see that. And then more and more patients have become savvy with respect to the internet. And they go on blogs and they read about what works, what doesn't work. Thermage got hyped. Everybody wanted Thermage after it was on Oprah. Within about 2 years, there were people walking around saying, "Well, it doesn't work. It doesn't work. It was the most painful thing I've ever done. It doesn't seem to work." Now, I'm not here to trash Thermage. I don't have personal experience with doing Thermage. But more and more patients have really become very savvy about what works and what doesn't work. And when, as Dr. Baker had already talked about, and Dr. Humble, I think, had referred to, is that with the media and the tabloids, anything that's not done well, that looks like nothing that nature or God would make, in a celebrity, gets shown in the tabloids. And patients come in all the time saying, "Oh my God, I don't want to look like that. I really am thinking about doing my lips, but I don't want to look like." For a while it was Meg Ryan, and then it was Lisa Presley, and so our patients have become a lot more savvy in terms of what they're interested in, and they want to look natural. And then lastly, and I'm going to talk about this, I have an opportunity to get to speak about using light for delaying skin aging, but people are interested in knowing if there are things that we are doing aesthetically that we're offering for patients and treatments that we're doing that actually delay the aging process. And I do think that the hyaluronic acid fillers, at least if you use them in certain areas, for example, like in nasal folds and in etched lines, it slows down the advancement and development of those lines. 2 years later, the lines will be less than what they were if they hadn't done the filler. So I do think that there's a benefit in terms of anti-aging there. I think this is my list of what are really, I think, the most popular non-surgical, kind of no downtime treatments with, is there a pointer at all? Oh, there is right here. Okay? With the botulinum toxins and the injectable fillers, which I'll be talking about hyaluronic acids, primarily Restylane and Juvederm, IPL for skin rejuvenation, skin tightening, laser hair removal, and microdermabrasion, and chemical peeling. I don't think this is a completely exhaustive list, but these are some of the most popular cosmetic procedures. And my word of advice really is starting out is be good at the home run procedures. There are certain treatments that are home runs. Botox, if you do it well, is a home run. The injectable fillers, Restylane and Juvederm, if you do them well, artfully well, they're a home run. They are a home run. And there's certain areas in the face, using Juvederm and Restylane, that's a real home run. And I'll go over what I think what those areas are, and pearls and the techniques with that. And skin rejuvenation. Non-invasive skin rejuvenation with IPL is a home run, if you know how to do it well. So my word of advice is learn how to do at least some of those home run procedures and do them well. And I think that's going to be the key to success. I do no advertising, and my schedule is booked with 20 to 25 people a day with fillers and IPL treatments, and that's without advertising. It's really all word of mouth. So what characterizes a youthful appearance? How many of you have children under the age of 20? Okay, so I have 5. 3 over the age of 20, though, and 2 under the age of 20. But when you look at your children, what really is the hallmark of youthfulness? When you look at your kids, you've got kids that aren't middle-aged. They don't have deep nasal folds. They don't have all these lines and wrinkles. They don't have saggy skin. And so there are 2 things that really are the hallmark of youthfulness. It's bright skin that reflects a lot of light, and it's a full face. So when you think about it, if you can create that for your patients, add volume back, create fullness in their face, lessen the lines that they've got, and create brightness in their skin, that's really the hallmark of youthfulness. So for example, with IPL, what is it that people really notice about IPL? It isn't that they notice that redness is less, or that brown spots are less, or that pores are less visible. What the rest of the world notices about IPL is, if you do it well, the skin is brighter. It reflects more light. And that's also true with fillers. If you use fillers, you're softening lines and wrinkles, reducing shadows, lessening contour defects, and that reflects light back in a brighter way. So that is really what the world should notice. Is that people somehow they look more youthful. So I want you to appreciate that. It's really the hallmark of youthfulness is a full face and is bright skin. It isn't a tight pulled face like this. So even 450 years ago, this Renaissance painter could portray in 2 dimensions youthfulness and aging. If you look at how bright the Christ child's skin is and how full that face is, and Joseph has that dark, sunken-in contours, and even in 2-dimension in oil painting, you can see the difference in how much light is bouncing back at your eye. That's how we really determine what looks young and what doesn't look young, is really how bright things look and how full the contours are. So the key to being successful with Restylane, with Juvederm, with the hyaluronic acids are really the following. It's picking the right patient. It's making sure that a patient's educated about what that filler is going to do for them. It's making sure that people have the right expectations, that they have really kind of proper expectations, that they know if you're going to be using Restylane for lip lines or Juvederm for the lips or the under eye area or the mid-cheek, they're going to have an idea what that result will look like. And that comes from educating patient. That comes from really your consultation. Having the patient look in the mirror, have them point out to you what they would like to see look better, and then explaining to them what you think you can do with the hyaluronic acid fillers. Lips, I think, are very much a personal preference. I think it's very arrogant of us as practitioners to go to a patient and say, "Oh, you need this. You look so much better if your lips are fuller." I think we can educate patients about what you can do with Restylane and with Juvederm for lips, but lips, I think, are very much a personal preference. And when somebody comes in and they're contemplating wanting to do their lips, I want to get a really good idea from them what it is that they have in mind. And how, if they want volume to their lips, if they just want the lines lessened, if they want the lips outlined so that the border shows better, if they want the corners of the mouth brought up. That's really what I want to know. And I can let people know, as we're talking about their lips, what I can do with the fillers, all of those 4 things, to make a difference, to have their lips look more attractive. I'm not going to just focus on lips, but lips, I think, are a good place to focus because it's such a great place for using Restylane and Juvederm. And then the proper choice of the injectable, using the proper amount, and then doing it artfully well. And that's really what it boils down to. Once you've determined that somebody's a candidate for Restylane or Juvederm, is really using the proper amount of the product and using it artfully well in the different places where you know you can create a more youthful contour, you can lessen lines. And then knowing how to manage complications. And Dr. Humble talked a little bit about some of the complications with some of the injectables. I'll talk a little bit about managing those complications. And I've seen almost every complication, other than I haven't seen vascular occlusion. Well, I have seen vascular occlusion. So I'll talk about the different complications that I've seen. So